Today I'm going to discuss hypothyroidism and Graves' disease, and I'm going to talk about the pathophysiology and how you diagnose disease and treatment for it. The pathophysiology for hypothyroidism is when there's an excess amount of TH being secreted. There are three types of hypothyroidism. There's primary, secondary, and tertiary. Primary causes the thyroid gland to release excess hormone due to a problem in the thyroid gland. Secondary is when TSH released from the pituitary gland, causing overstimulation of the thyroid gland. The last one, tertiary, is caused by excess TRH from the hypothalamus. Now that we know the types, I'm going to talk about the signs and symptoms. And those include heat intolerance, increased appetite with weight loss, increased frequency of bowel movements, nervousness, anxiety, tremors, tachycardia, which is fast heart rate, and palpitations. These are caused by an increase of TH, which increases the metabolic rate. This also increases the number of beta androgenic receptor sites in the body, which increases epinephrine and norepinephrine. Graves' disease can cause hypothyroidism. Graves' disease is an autoimmune disorder in which thyroid-stimulating antibodies causes the thyroid to produce too much TH. And a lot of times you'll see people with Graves' disease have bulging eyes. Other things that can cause hypothyroidism are thyroid nodules, inflammation of the thyroid, thyroid tumor, also tumors in the pituitary gland, radiation exposure and heredity, and goiters, which is enlarged thyroid. And you can see that when their throat is very enlarged. Some complications of this disease include a thyrotoxic crisis, also known as thyroid storm. This is a severe hypothyroid state that occurs sometimes in hyperthyroid people who are untreated and who develop another illness or stressor. Thyroid storm can also occur after thyroid surgery if people do not get the proper medication before or after surgery. Thyroid storm can result in death in as little as 2 hours if it goes untreated. Symptoms are tachycardia, high fever, hypertension, dehydration, restlessness, delirium, or coma. Now that we know about the disease, I'm going to talk about how we diagnose it. Well, we're going to draw blood, and then the blood will show an elevated TA, T3, and T4. And in primary hyperthyroidism, the TSH is low, but if you have hypothyroidism due to the pituitary gland, it will be high. A radioactive iodine uptake test or a thyroid scan can be done to see if activity in the gland, and it can also be done to locate a tumor or a nodule. Thyroid glands may be enlarged, but they should only be palpated by a physician or an advanced nurse. If it palpated too much, it can cause the thyroid to release more hormones, which we don't want. TSI, thyroid-stimulating immunoglobulin, is present with Graves' disease. For treatment for these patients, there are many medications that can be used, but some of the most common ones that I'm going to talk about are prophylauracil and tapazole. They inhibit the synthesis of TH, and the downfall for these is that they may take several months for them to be effective, and they must be continued for 12 to 18 months. Propranolol is prescribed to relieve the symptoms of the sympathetic nervous system, and a high dose of oral iodine will be given to suppress the release of TH, and calcium and vitamin D are given to protect the bones. In some cases, radioactive iodine is used to destroy a portion of the thyroid. Sometimes surgery is planned, but proper medication is needed prior to the surgery, like I mentioned before, due to the thyroid storm. Sometimes the surgeon may want to keep some of the thyroid in there just so it can produce some of its hormone, but if it's all taken out, or it depends on what the doctor wants, but you may have to be on some hypothyroid medication such as Synthroid. And my last little thing I have to say is that women are likely to develop hypothyroidism more than men, and young women are more likely to develop Graves' disease. And thank you.